Hi, welcome. I'm Dr Khaled Sadek and I specialize in the removal of cysts and lipomas. In this video, we're going to show you the kind of work that we perform at lipomacyst.com, the home of cysts and lipoma removal. Now, as they say, out of sight, out of mind has never been truer than with a cyst behind the neck or on the back. You can't see it, it's out of mind, it's out of sight, and that's how they end up growing so big. But I always say, better out than in, because they can get infected. In this video, I'm going to take you through every step of how we go about removing the sac, making sure it doesn't grow back, and also leaving the minimal scar, which everybody wants at the end of the day. So remember, if you're not subscribed, make sure you are subscribed, because you'll need to be subscribed to watch these videos. Make sure you're signed in, put your comments down below, and don't forget to join us on the Sunday night live. That's around 9 p.m. GMT, but obviously if you're subscribed, you get notifications for that as well. And obviously if you've got questions, put them in the chat down below, or email us at lipomacyst.com, the home of cysts and lipoma removal. Enjoy the video. So before we begin, what we want to do is prepare the skin. That means applying a disinfectant followed by the local anesthetic. As you can see, the local anesthetic just collects in pools under the skin. We get it right in the subdermis, doesn't need to be any deeper than that. And then we make a small incision. In this case, it's a vertical incision, because when you think about how the movement of the neck compares to other parts of the body, it's very much in a vertical axis. Your head goes kind of up and down, and so if you put the incision vertically, then you're not going to have any risk of having to open that wound when you kind of flex the neck, compared to if you have a horizontal, a flat incision. So if you had a flat incision and then you kind of bend the neck towards your chest, then you put a lot of tension on that scar, and so there's a much greater risk. Not so much of the scar opening, but definitely once the sutures are out, there's a risk of having sort of a stretch scar. Right, so that said, we're down to the subdermis. We're going through the skin layer. We're just separating the fascia here with some blunt dissection using the artery forceps. You all kind of know that. As you can see, nice clear field, not much blood. Using a swab there just to kind of patch things up as we go along. I don't tend to use too much sharp dissection, as you all know. It's much better for tissue handling and healing. Patients heal a lot quicker. They scar less as well. So there we go, boom. First incision goes straight through the epidermoid cyst lining, and we put the artery forceps in, and there we go. Just some digital manipulation, and gosh, wow, that's a lot of stuff coming out there. Now remember, this cyst's probably been at the back about 6 years, so the content is pretty insane. But the beauty of this process is we drain it, tiny little cut, and then we get the whole sac out. Give it a little bit of a squeeze, because there's always a little bit more left in there. So there we go. It's coming out very clear. It's not infected. It's got that kind of granular sort of soft cheese composition. That's typical of a normal non-infected epidermoid cyst. But remember, this is oil. This is high in calories, and if bacteria from the skin manage to breach the skin and into that inclusion cyst, then it's wham bam, strawberry jam, the whole thing will get infected. You have a massive abscess. Now if you've ever had an abscess, you know it's very painful, and even more so when it comes to the surgery, because remember, the anesthetic doesn't work 100% when the skin's infected. The pH, the acidity in the skin changes, and the way that local anesthetic, the way the lidocaine operates, when it hits those pain receptors, it's got to have optimum condition, and that means a slightly alkaline composition in the fluid around the nerves. That said, none of that going on here. We're into the cyst, and we've applied a little bit of light traction, and again, a bit of blunt dissection there with the gauze, and then just kind of feather cut the fibers off. Remember, if you haven't subscribed, make sure you subscribe. You have to be subscribed to get access to these videos, because remember, they're going to be age restricted, so you need to be subscribed, you need to be signed in. Put your comments down below. Remember, there's a live chat as well on Sundays. We're going to make 2025 a year to remember for lipomacyst.com, the home of cyst and lipoma removal. Remember, if you've got a cyst and you think of getting it done, don't delay. Get it done as soon as you can, because the sooner you get it, then less complications and no risk of scarring. As you can see, this video is filmed in real time, so you're under the knife in less than 10 minutes. Ooh, bit of a tough one. It's been there for several years. It doesn't like its eviction orders, but it's coming out, and it's coming out today. We keep that incision nice and small. It's about 1 centimeter, and again, not much blood. That's pretty good, right? And the patient's awake, very comfortable. Ooh, look at that, bit of a cauliflower discharge coming out there. Bit of a surprise, but you always get that as you get to the base of the sac. Remember, there's kind of like this lining. You give it a squeeze and it just kind of lets go if it's final remaining sebum. Now that sebum is oil, it's dead skin, it's keratin. A lot of people ask me, does it smell? Doesn't always smell, but does have a distinctive smell if it's infected. And you may notice if you do have sort of oily skin or sebum and you squeeze it yourself, it does have that kind of vinegary smell, I'd say, like a cider vinegar type smell. Very rancid and acidic, but in this case, not a huge smell. And there we go, cyst is out in all its beauty. And as I sort of spread it on the swab there, you can see that sac is out, and you can put it all together.